Well, hi everybody. Today I'm with Dr. Abigail Powell, and she works with moms as a licensed psychologist with advanced perinatal and postpartum training, as well as being certified in nutrition as medicine for mental health, which I'm so excited about. So welcome.
Hi, thank you so much for having me.
Awesome. I'm so glad you're here. So tell me, what's one thing you would love for the world to know?
So, I would really like the world to know that there is no one way to treat a specific issue that one may having, whether it be physical or mental. Every body is different, and a personalized care plan is truly essential to healing.
Wow, that's really good. That sounds really right. So tell me, how did you discover this?
So, discovering this mainly when I was struggling to manage my own ADHD as a mother, breastfeeding, and pregnant. I did not want to rely on medication alone. And then I began to question my own lifestyle choices I was making, which ended up with me just making really consistent small changes that has now resulted in me personally no longer even qualifying for an ADHD diagnosis, having lower anxiety, and even just a more positive mood. So I found out if I could expand this, specialize in more holistic healing along with evidence based therapies, that I could really help other moms do the same.
So, so cool. And what's the first step that someone would take?
So, first, I would always recommend that moms analyze their diet by looking at what processed foods they may be eating, as well as learning to read a label effectively. So, I know that there's a lot of really big words. For me personally, if I cannot pronounce a word, typically I question if I really want it in my body and I'll take it a step further.
Yeah. You'll keep looking. I think it's so important what you're saying because it's like there's so many people getting tips out there, but
Hmm.
actually, and sometimes we can, if we're already overwhelmed, we'd look at more tips and stuff like that.
We look at more tips and then it's almost increasing that overwhelm for a mom, and we feel like we need to make these huge changes which
Yeah.
aren't actually going to stick.
Yeah. And maybe they're often not deep enough. I know, and I love how you're talking about just that holistic and evidence based. I think it's
Mhm.
time that our field combine those things.
Yes.
But I totally understand how you feel about not wanting to add to parents' plates because in a way when parents come to me and I do play therapy and work with parents, you don't want to say do this and this when everyone's already so anxious.
Right. I mean, when we're already feeling completely overwhelmed, what a recommendation, no matter what your specialty is, comes to you, it's going to go in one ear and out the other because your body's already set in fight or flight. So we
Yeah.
just need those tiny things.
It's kind of like when your mom tells you advice. Like my mom is really into health and I'm like, "Mom, you do not want to
Right.
hear it." So you're talking a little bit about just the first step is getting familiar with getting rid of stuff you can't pronounce, and I love
Right.
it. So what's a common obstacle that people face?
I mean, I'm sure so many people agree with me, no matter what modality you work with, but consistency. So, of course,
Sure.
we know that we're going to have days where we could have treated our bodies better. Rest, especially as a mom, rest is so important, and we just are not getting enough of it. But finding that balance and consistency in the beginning is going to make the changes easier to implement as time goes on, but it also becomes a more natural feeling instead of fighting the cravings that one might feel in the beginning. So if we're consistent, if we're really encouraging ourselves to make those small changes, such as starting our day off with protein instead of sugar, we're going to find that that consistency is going to stay with us.
Yeah, that's what I was just going to say because there's some changes you can make that help you with the consistency. So, and it's like, don't pick something that you can't do consistently also. Like there are some extreme diets that if you've been around long enough, you know about them and you think that would work, except that you can't do it consistently.
Completely.
But I love that tip about the protein for sure. Okay, so how do I know if I'm doing it right?
Well, I would say you know that you're doing this right when you're noticing that your symptoms are more manageable. Now, the human body is supposed to feel anxiety. We are supposed to know what that feeling is, or else we wouldn't be feeling it. Now, I know that a lot of people enter therapy or some sort of medication intervention in order to no longer feel that. However, a lot of the time that anxiety is our body saying, hey, something's off. And that's why I kind of combine the evidence based therapy. So we're able to figure out Is this reasonable? Is this based in logic? Let me help my anxiety in that way. But essentially, anxiety is there to tell us something. However, we will be able to notice that feeling in our bodies, analyze that situation, and take action without feeling our symptoms getting out of hand when we have made that's when we know that we've made immense progress. So a huge thing for me is I know that anxiety and a glucose drop have these same symptoms. If as moms we are not eating until noon and then we are not eating until dinner time, we are very likely going to have a massive glucose drop that can be rooted in shaking or that feeling of anxiety, those wandering, intrusive thoughts. And it could really just mean that our body needs something inside it. We need nutrients, but it's us saying, oh my gosh, I'm having a panic attack, I'm having an anxiety attack. It's just those little things that can, just eating on a schedule, it can really take us to the next level of our health.
I think that's so important. It's like, I like to talk about how I like to study a lot about schedules and talk about how my grandma used to eat and just remembering how she was very steady with things. She wouldn't eat outside of meal times. And so I do sometimes ask parents to think about how they were raised or how their parents would have been raised when looking at that. So it looks like that's a part of it. I'm so interested in what you're talking about because at the very beginning you said that you help to manage your own anxiety, ADHD symptoms and anxiety. So do those go together?
For a lot of women, so ADHD can often be masked as anxiety. I personally, I would see therapists at a very young age. I was diagnosed with ADHD at 6,
Oh, wow.
and it created a spiral of, oh, I guess I'm not good enough. ADHD means that my grades can't be good. And then self-esteem problems, which really it was manifested all in anxiety. And so someone kept on going, well, you're anxious, without me consciously knowing about my ADHD diagnosis. I was 6. What am I going to know?
Yeah.
But as I grew up, learned about that diagnosis, read through my own files, I started noticing this anxiety that I'm feeling, it's because I am struggling to concentrate. It's because my mind is wandering in places and it does have a connection to low self-esteem. And so becoming more aware of that and taking these new courses, changing my lifestyle in a more natural, holistic way, as well as the way that I eat, I do see a huge difference. I no longer need to take any sort of medication,
Mm, wow.
and I'm able to just use the nutrients that I'm getting through food, as well as I always really push omega 3s. So I'm always going to be taking an omega 3 supplement and my probiotic.
Yeah.
And so making sure that my gut health is great. I have not needed any sort of stimulant or any sort of medication since.
That's fascinating because I didn't realize you were even diagnosed as a little child.
Mhm. Yep.
Wow. And it's so interesting when we hear like you have anxiety, but we're not given much to manage.
Right. They just say, oh, you have this. When told that I scored highly on the general anxiety disorder assessment, they just said, "Do you want Prozac?" And that's it, with no follow up. And I
Yeah.
needed I needed more. Personally, I believe that our moms deserve better.
For sure. That's what I love about your saying the personalized plan.
Hmm.
Personalized combining I think we said crunchy, we're talking
Hmm.
about crunchy and evidence-based.
Yes.
So very cool. Okay, well, that's our time. So thank you so much for sharing this with us. And I'm going to include all your contact information because I think what you're doing is so important and holistic and supporting moms. So thanks for being here.
Thank you so much for having me.
Yeah, thanks.